Today we're going to be doing a virtual knee examination. I'm going to start by having you cross your arms and stand up from the chair without using your hands. Looking for strength. Now I'm going to look at your alignment. So looking if your knees are knock-kneed or bow-legged. Now turn to the side. Looking at the knee hyperextension, or if you're lacking that extension, that movement. I'm going to go ahead and have you walk over to the back of your chair. Hold on to the chair, but face me, please. And I'm going to have you stand on one leg and just squat down like a mini squat. Good. And come back up, just looking at how good your strength and control is. And then the other side. And we compare the good and the bad side, looking at that strength and control. Good. All right. So now I'm going to go ahead and have you walk towards me. And I'm just looking at the alignment, looking for symmetry, looking at her pelvis. Turn around and go ahead and walk back. Again, looking to see if her pelvis drops, looking at her knee alignment, looking at her feet. Go ahead and turn to the corner of your room. Now I'm going to check your strength. So go ahead and push up on your toes, and you're going to walk over to the corner. And again, this is the S1 strength. Good. And turn around for me. You can hold onto the chair if you need to for balance. And you're going to walk on your heels. This is that L4 strength. And now you're going to keep holding onto the chair. You're going to face me. And now you're going to stand on one leg, stand on your bad leg. There you go. And now bend a little bit. And now you're going to pivot and tell me if that's uncomfortable. So that's that Thessaly test looking at the meniscus. Now I'm going to go ahead and have you sit down, please. And I'm just looking at your knees generally, if there's any swelling, if there's any atrophy where the muscles are maybe not the same size on both sides, any scars, any other skin lesions. Now you're going to tell me if anything's uncomfortable while you're feeling it. We're going to have you start by pointing to the area of pain. And then let's start on your affected leg. So let's say your right leg is your bad leg. I'm going to go ahead and have you put your hand on your thigh and then feel down just above where your kneecap is. And let me know if that's tender. There's kind of a ropey tendon you can feel. That's the quadricep tendon. Then you're going to feel over your kneecap. And then down under your kneecap where that soft part is, that's your patellar tendon. And then down to that bony attachment, the tibial tubercle. And you let me know if any of these are tender. Now I'm going to have you go towards your other knee, kind of on the inside of your leg. And you'll feel a kind of a squishy place there, maybe a little uncomfortable. That's that pes anserine bursal, again, looking for discomfort. Now I'm going to have you come up the inside of your knee and you can kind of strum it. There's like a kind of a tight band there. Let me know if that's uncomfortable. And now go from there over to underneath your kneecap, kind of along, that's the joint line, back to that patellar tendon. Then keep going out to the side. There's kind of a groove there if you can feel it. That's that lateral joint line. And then when you get out to the side, you can strum that lateral ligament. Let me know if there's an area of tightness or discomfort over there on the lateral side. Now I'm going to go ahead and have you take that leg and put it straight out in front of you and just a little bit bent so it's not locked out. Now push on the outside of your knee and you're pushing into the other knee. We're looking for stability of that medial collateral ligament. Now you can reach down with the other arm and push, and you're pushing out to the side, again, looking for that lateral stability. And if you want, actually, let's go ahead and have you compare that to the other side. So put that leg out, push on the outside of the knee for me, pushing in, looking for stability. And then on the other side, very good. Make sure you don't have that knee locked. There you go. So that's looking for that stability. Now we're going to look at the range of motion. So you're going to go ahead and grab your leg and bring your knee up to your chest. And then looking both at the hip and the knee flexion. There you go. Good. And do it on the other side just for comparison, looking for that hip and that knee flexion. Good. Now we're going to look at the hip rotation. So on the right side, keep your thigh parallel to the floor and swing your foot out to the side. There you go. And let me know if that's uncomfortable. Now we're going to compare to the other side. So swing that other leg out to the side. There you go. Good. And looking again at the symmetry between the two. Now on the right leg, bring your foot like you're crossing your ankles. Bring it in. There you go. And again, thighs facing the camera. Yep. Do it on the other side. Bring your heel in. There you go. And let me know if that's uncomfortable. And again, looking for symmetry between the two sides. Now I'm going to go ahead and have you let that bad leg is your right leg. So we're going to have you stick that leg out straight, all the way out. Relax the leg. Reach down and grab your kneecap for me. And I want you wiggle it side to side. Let me know if that's uncomfortable. That's looking at that patellar mobility. And now I'm going to have you go ahead, keep your foot on the floor and just tighten your quadricep muscle. Let me know if that's uncomfortable behind that kneecap, if that reproduces the pain. And then we're going to go ahead, you can relax. And now you're going to go ahead and do that again and push on the kneecap, add a little bit of extra pressure. Let me know if that's uncomfortable. And if not, then that's good. That again, that's just looking for patellofemoral pain. And then I'm going to have you go to the outside of your knee so you can find that lateral joint line where your kneecap is, kind of walk over to the side and then up a little bit. There's usually kind of a little bit of a tight, tender spot there. You can find that spot. And then I want you to straighten your leg out and bend it back and forth and just see if there's discomfort where you're pushing. And that's that Noble compression test. Very good. And then if there's some concerns about this knee pain coming from the back, then we would do the neurologic exam. We would do that motor, that sensory test, and the provocative. If there's no concerns that it's coming from the back, that would be the end of the exam. Great, thank you.